Well, long story short, it was not hard to say yes to accepting the volunteer opportunity to help chair the Longest Day event, and really pleased to have formally said yes to that. Because quite honestly, an opportunity that I've been searching for in my own personal life. I just hadn't found the right one yet, and this one felt obvious and felt very real. And so, in that sense, it made it very easy to say yes to. So I'd like to share with you a little bit about, the next slide here, my reason. As I've known, we're all here for very specific reasons. Some of them, we have some things in common, some are very different, but it's clear that everyone that is involved with trying to tackle and progress towards the end of Alzheimer's in our lifetime and our children's lifetime, it's for a reason. And for me, it's obviously personal. So some people in my life on the side to the right here, my grandmother Betty, a wonderful lady, so energetic. She was a short lady, but you never mistaken her for her energy or passion. She succumbed to Alzheimer's back in 1989. And it was powerful for me to watch my grandfather, who was the joy of her life, and likewise as he cared for her until she passed on. And then it was in 2022 that I lost both my mom and my dad on the same weekend, actually, with relations to this disease. It was dementia. But my father, who was the caregiver for my mother, had invested so much of himself that he basically wore himself out. And so he went first, we believe tied to a heart attack. And my mom, who was 2 rooms over, just wasn't in the position to help herself. And we believe she passed of diabetic shock shortly thereafter. So, obviously devastating. And I know there's hundreds of stories out there. So I share this with you personally, but also to respect the many experiences we've all had and how this disease impacts us. But on the living side, I happen to have my 2 aunts in my life that I still cherish and care about. My Aunt Marcia, who's several states away, my Aunt Pam, who is now in Indianapolis after moving from Texas at the point in time where she knew she couldn't care for herself. And she always was my favorite aunt. She was known for me with long nails, and I'd always say, Aunt Pam, could you give me a back scratch? And she'd be happy to do it. And to this day, she's a really neat lady. She's at the young age of 75, and she's a whippersnapper. And if I can all ask for your help, her biggest request is to find a boyfriend. But I just don't have a really good network of men in the age of 75 that are eligible bachelors. So if you know of somebody, I'll have to interview him, to be honest. But I'm accepting referrals. So give you an example of she's still very spirited and passionate and very sociable. So I'm sure you'll have a chance to meet her at some of our social events in the future. But beyond the personal story, the people that I love and cherish, I do have a medical device and diagnostics background. So I'm very aware that every tissue sample, every patient sample, every diagnostic result that literally can make or break the outlook of people's lives is really important. And with that, I think we're all aware of how much promise there lies in the future for research. I've not pulled that trigger yet, but I plan to participate in some research in the near future for all the benefits and insight that can bring. So that is in my future. But beyond that, I'm just optimistic, maybe a little stubborn and hopeful. And I know I'll draw energy from you all and the others that will touch in this mission to support each other and doing together what we want to and need to do. So that's all for me. I think, Jennifer, we've got more to come. Maybe Natalie, it's back to you.
Well, hi, everyone. My name is Natalie Sutton, and I have the honor of serving as the Executive Director for the Alzheimer's Association Greater Indiana chapter. I always like to start a presentation by sharing that, like Pete and like so many of you, I also came into this role with a personal and family connection to dementia. We lost my grandfather, my grandpa Don, with vascular dementia back in 2016, and I joined the team at the Alzheimer's Association shortly after in 2017. So I do remember my grandpa and think fondly of my grandmother, who's still living outside of Evansville, and the care that she provided to him in his last several years of life when he was suffering from the vascular dementia. It's it's my goal tonight just to provide you an update on some of the work of the Alzheimer's Association, the Greater Indiana chapter specifically, and the impact of Alzheimer's disease on all of us and on our community. So I'll start with the hope. Our vision at the Alzheimer's Association is a world without Alzheimer's and all other dementia. And I think it's really important to note a couple of things if you might be new to our organization. First, while our name is the Alzheimer's Association, we do focus on all forms of dementia. So we know that the caregiver journey and some of the resources that are needed and the research that is needed across all forms of dementia are important. And we were founded back in 1980 with the goal of creating that world without Alzheimer's and all other dementia through research, but also with a really strong foundation in care and support. We were actually founded by a philanthropist who is passionate about research and a group of support group leaders throughout the country who came together to start our organization. So those two pillars of our mission have been evident from the beginning of our time as an organization. And just to explain some of the terms that we're using, and Dr. Brosh, I'm sure, will build off of this foundation. Dementia is an umbrella term that describes a set of symptoms. And those symptoms also often include loss of memory, other thinking abilities, and interfere with daily life. We like to remind everyone that dementia is not normal aging. But there can be many causes of dementia, and Alzheimer's disease accounts for the greatest portion of dementia, with 60 to 80% of dementia caused by Alzheimer's disease. And there are other causes of dementia too. I mentioned vascular dementia with my grandfather. We have Lewy body dementia, frontotemporal dementia, and other forms of dementia. And ultimately, we think that in many cases, there may be mixed dementia. There may be dementia occurring that's caused by several of these things. So that's a really important foundation for our discussion tonight. Currently, more than 6 million Americans are living with Alzheimer's disease. This does not include those other forms of dementia. And it includes, though, about 110,000 Hoosiers who are living with Alzheimer's disease. So a big impact here in our state. And unfortunately, those numbers are growing. By the year 2050, we anticipate that 6 million to reach nearly 13 million people living with Alzheimer's disease. So still anticipating significant growth. And we consider this based on the number of people age 65 and older with Alzheimer's dementia. Aging is the biggest risk factor for Alzheimer's disease or other forms of dementia. And a lot of times sorry, I have my slides out of order here. Yes, so there's a huge impact with those numbers and the growing prevalence of the disease. There's a huge impact on cost. And these numbers represent $321 billion in annual cost for Alzheimer's and other forms of dementia. That represents only the cost of healthcare. It doesn't include all of the other costs to our families, our community, our society, like the cost of unpaid care and family caregivers and productivity, which we'll talk about in a moment. But these are a significant portion of these dollars are paid by Medicare and Medicaid. So in theory, there's a cost to all of us, regardless of how we've been touched by Alzheimer's disease or other forms of dementia. And of course, there is also a cost in the workplace. 1 in 6 employees provides some level of care for a family member with dementia. Many caregivers have to go in late or take time off. 2/3 of caregivers are women. 1/3 are daughters of adult parent or adult children, daughters of a parent with Alzheimer's disease or another form of dementia. 1 in 3 of our caregivers is 65 and older, and over half are caregivers who take care of their parents. When we think about Alzheimer's in the workplace, I always think of the sandwich generation too, people who are still caring for children in their home, but also taking care of an aging parent. And I think the next statistic is astonishing. 41% of caregivers have a household income of $50,000 or less. And we know the financial devastation that Alzheimer's and dementia can create for a family. And finally, 66% of caregivers actually live with the care recipient in the community. Pete, I think your story of your parents is so touching. And we do see caregivers so often suffer from other health conditions and really have mental health struggles based on just the intense nature of caring for a loved one with this horrible condition. So that is a little bit about the impact of Alzheimer's disease and dementia and why we work so hard at what we do at the Alzheimer's Association. But I do want to shift gears a little bit and talk about that work and what our work looks like here in the community. Our mission is to lead the way to end Alzheimer's and all other dementia, but we do that through accelerating global research, driving risk reduction and early detection, and maximizing quality care and support. So again, we know that that vision of a world without Alzheimer's and dementia is going to come about through research, but we can't just focus on research. We also need to take care of people who are living on this journey right now, and we provide a number of really incredible resources to support family caregivers. And so that leads us to the care and support. Our care and support programs, which are a key pillar of our strategy at the Alzheimer's Association. We currently are running more than 50 support groups throughout the Greater Indiana chapter. These are support groups in communities throughout the chapter territory that are facilitated by volunteer leaders who've been trained by the Alzheimer's Association. So it is our goal that if a caregiver is struggling for caring for a loved one, they'll be able to turn in their community to a support group where they can receive that peer support and be connected with others who are on a similar journey or have been on a similar journey. We also focus on the delivery of education programs. In our last fiscal year, we delivered 183 education programs throughout the Greater Indiana chapter. And with our education programs, our support groups, and some social engagement activities for people in the early stage of the disease, we reached about 6,000 Hoosiers with these services. We're really proud of that work. We know that when someone encounters the Alzheimer's Association and our programs in the community, we can lighten the load for that individual and their journey, but it's not enough. So we're very actively focused on growing the reach of our programs and services. We also do have activities to help people navigate the disease through our website and our 24/7 helpline. If you take away nothing else from tonight, I hope you'll remember the 24/7 helpline, which is an incredible resource and a great first place for anyone to start if they're interested in the Alzheimer's Association or the programs and services that we offer. It is 24/7 because we know that this disease does not neatly present itself in business hours, and any of you who have been caregivers know how that is. So remember the 24/7 helpline and be sure to share it with someone who could benefit from that service. And if you're interested in any programs in the community, please connect with us. We'd be happy to educate groups or clubs or organizations that you're a part of. In addition to our care and support services, we are the leading voice advocating for those living with Alzheimer's disease and other dementia and for their caregivers. We fight for research funding and care initiatives at both the state and the federal levels. Here in Indiana, we're in the middle of running some really exciting legislation during the 2023 Indiana General Assembly. We are pursuing legislation that will create a dementia care specialist program in the state. It does come with a fiscal ask in the state budget, and so we're working really hard to navigate all the pieces of that process to hopefully make that happen in 2023. And then in our federal priorities, we will have a group of advocates, 11 advocates from across the state of Indiana who will travel in March to Capitol Hill. And we'll be pursuing a number of public policy priorities, but at the top of the list is ensuring Medicare and Medicaid access for these new treatments. And I'm going to just plant that seed because I know Dr. Brosh is going to share a lot more tonight about what these new FDA approved treatments are and how we will ensure that they can benefit those who need them. Finally, we also focus on raising funds and awareness in the community. We're here tonight to talk a little bit about the Longest Day program, and we're so proud that the Greater Indiana chapter was number 7 out of 74 chapters throughout the country in our Longest Day fundraising total. So thanks to any of you who've already participated in the Longest Day and helped us raise those funds that put us in the top 10% across the country. In the Walk to End Alzheimer's, probably the largest community event that we're known for here in our community and throughout the country, the Greater Indiana chapter was number 9 in fundraising out of 74 chapters. And the Indianapolis Walk had a milestone year in 2022. Last year, we celebrated our first $1 million walk in Indianapolis, and we were number 6 out of 630 walks across the country. So really incredible results. We like to say here in the Greater Indiana chapter that we're punching above our weight when it comes to Indianapolis's place on the map of these fundraising events. We also have a Chocolate Sunday Brunch Gala that has historically taken place every November. In 2022, we raised over $400,000 at that event. And I just want to make clear, all of the fundraising is so important to enable us to provide these services in the community at no cost. None of the services that we provide as an organization have any cost or any billing associated with them. Everything that we're able to do for those living with Alzheimer's and dementia and their caregivers is not only free of charge, but it is made possible through the generous support of our donors in the community. We also really work to raise awareness. We want the public to know about Alzheimer's disease and other forms of dementia. We want people to know what they need to know and feel comfortable going to their healthcare providers to talk if they are concerned. But we also want people to know about the Alzheimer's Association and the resources available through our organization and other organizations in the community. And so to that end, we do focus on public relations and ensuring that we're present in the local media and also on social media. So make sure you follow the Alzheimer's Association Greater Indiana chapter on social media channels if you have not already done so. And then diversity, equity, and inclusion is a key part of what we do across our entire organization. It is a standalone pillar in our strategic plan, but we know that historically underrepresented and underserved communities are in many cases have a higher prevalence of Alzheimer's disease and other dementia. And so we step up our outreach efforts in those communities. And we're really excited at the Greater Indiana chapter right now. We are hiring a director for diversity, equity, and inclusion to lead some of this outreach here in our chapter territory and in our community. And so we expect to just grow that work considerably over the next couple of years because it is so important. And now, finally, we're going to talk a little bit about research. The Alzheimer's Association has worked hard on the advocacy front to help increase federal research funding from the National Institutes of Health and the National Institute of Aging. And we're also really proud that we've seen a lot of that federal funding come back to the state of Indiana. And so our funding is the third largest source of funding after the United States government and the government of China. The Alzheimer's Association has $310 million active in 950 projects in 48 countries around the world. And And some of what sets the Alzheimer's Association funding of research apart from the federal funding is that we do fund globally around the world. Of course, the federal government just funds research happening here in the United States. In addition, we really focus on bringing new investigators and new ideas into the field. So in many cases, we'll take some more risks than the federal government would to fund a novel idea that can then later be scaled up into a federal grant. We have $2.9 million in active research funding here in the state of Indiana. And I think another exciting fact of which you might want to be aware is that the state of Indiana University is number 4 in the nation for Alzheimer's and dementia research funding from the NIA. So we do have a lot of research leadership here in our community. While research is something we do globally, we're super proud of Indiana's leadership, which is a perfect segue into my introduction of our next speaker, who is one of the leading experts on Alzheimer's disease. I very briefly mentioned new FDA-approved treatments. And before I turn it over to Dr. Brash, I just want to say there has never been a more exciting time in our work in this cause, in this movement at the Alzheimer's Association. Thanks to our work in all of those areas that I mentioned over so many years, we're now at a point where research has developed 2 FDA-approved treatments that Dr. Brash will share more about. I want you all to know that at the Alzheimer's Association, we're extremely committed to making sure that the people we serve and the constituents we represent will have access to those treatments. And in fact, our number 1 federal priority right now is to fight for access through Medicare and Medicaid. Now, we know that someday we will clear that hurdle and we will have Medicare and Medicaid access for these treatments. But when we do, it doesn't mean that the challenges with access will be over. We know underserved, underrepresented communities, rural communities, there are going to come a number of access issues. And so I do want to share that we're so committed to ensure that when research produces treatments, those treatments are translated into care for the people who need them. And with that, one of those people who will help translate those treatments into care and provide that care here in our community is Dr. Jared Brash. Dr. Brash, thank you so much for being with us tonight and for sharing more with our audience.
Thank you, Natalie. Thank you, everyone, for having me. I'm wearing my Alzheimer's Association tie today. If you didn't notice it, it's kind of hard to see from the Zoom video, but I love hearing about the success of the Indiana chapter of the Alzheimer's Association. And you heard briefly about how Indiana is one of those hot spots in the world for the treatment of Alzheimer's disease and the development of research that's going to translate into a cure. And we're very, very excited in this time right now to be able to work on all of those treatments. So I put together some slides here that just highlight what I think are some of the most important things for people to know right now. And I hope you get something out of it today. So the way forward, as I see it, number 1 is definitely early diagnosis. Okay, we know this is absolutely key. It has to be the key. And just like when you saw the pictorial from Natalie about the umbrella being dementia, we actually want to diagnose Alzheimer's disease before a person has dementia, right? Alzheimer's disease is something that we think takes place in brain cells 10, 15, 20 years before they ever show their first symptom. And so we need to find ways to detect it and attack it before it's already caused the damage leading to dementia. So this is really, really important. And one of those ways that we can try to identify people in advance is to just ask them about it, right? So maybe primary care doctors and other folks should be just asking people, do you have a problem? Or have any of your family members said you have a problem with your short-term memory? Do you forget things? And just even starting at that point, saying, here's this minor little issue that someone has detected. Can we dig in and really detect that Alzheimer's disease is at the core of that? Because that's when we want to really attack this condition. You know, a lot of people are stoic about their problems, or maybe mom's covering for dad or dad's covering for mom. And if a child has a suspicion, then sometimes it's actually helpful if they reach out to their primary care doctor, right? HIPAA privacy prevents doctors from being able to tell children what's going on with their parents unless their parents have given us express permission. But children are more than happy and more than allowed to call in and say, hey, I'm worried about my dad's memory. I just thought you ought to know. And that goes in and it gets messaged to doctors. And that's one thing that a person could do to try to raise awareness. I think that there's probably, we could do a better job as physicians of asking those questions. And part of the problem is that the healthcare systems are not rewarded for doing so, right? We're rewarded for managing blood sugars. We're rewarded for keeping blood pressures in a tight window. But nobody is rewarding a healthcare system to detect dementia early, to detect Alzheimer's disease early. So that's something that's going to have to change on a national level for us to really be able to push some of these initiatives through into the places where we need it the most. I think this also is a great time for the community as a whole to consider, are there ways that we can, as a community, reach out? Can we help people understand that if we identify problems early, there are now treatments that we can use to help a person maintain their independence, which is everybody's goal. Whereas before it was just sweep it under the rug, right? We've seen the evolution in cancer, right? People will post it on Facebook and on social media. I've got cancer, I'm going to beat it, right? But you don't ever see people saying, I've got Alzheimer's, I'm going to beat it, right? So we need to change that. And we need people to say, I've got it, we found it, but I'm treated and I'm going to be independent longer. Right? That's absolutely one of the goals that we need to eventually make it to. Next slide. So one example of how IU is trying to forge the way here is through what we call the Digital Project. This is funded by a large global organization. We're one of 7 global sites. And the goal with this global organization was to try to help detect Alzheimer's disease early. And so when IU envisioned it, we envisioned empowering our primary care doctors to try to give them the tools to help detect people early. And so we helped give them iPads that have a digital cognitive assessment on it that takes less than 5 minutes. It gives a green, yellow, or red stoplight. Should we be worried about this person? If the stoplight's red, we probably ought to be taking immediate action. If it's yellow, we should think about it some more. And if it's green, that's great. Keep doing what you're doing. Let's focus on lifestyle changes and things like that. We've also created a new role called the Brain Health Navigator, which is a nurse who referrals can be made to, where she will spend an hour talking to people, just like a diabetes educator or a pharmacist helping someone manage a chronic medical condition. And they can do screening tests and talk about medicines that might not be great, like don't take over-the-counter sleeping aids. They can cause dementia. Don't take sleeping aids, period. There's some new research on that too. So all of these things that we know can help prevent dementia, we can have a conversation with someone boots on the ground other than a primary care doctor. And then recently approved too, and something that we're starting to enact, are blood-based biomarkers. So can we do a blood test that helps us know if a person might be dealing with Alzheimer's disease? And these are very new and cutting edge, and we're developing the right sort of tools for doctors to be able to talk about these blood tests, but we are starting sort of en masse treatment and detection with these new blood-based biomarkers within these studies that I've been talking about, so that we can understand them and see how useful are they. But it looks like this could be the next best way to detect things early as well, but it needs to be in the right context. Next slide. So just a little bit about the drugs. So Aduhelm was the first one that was approved on June 7th, 2021 through the accelerated approval pathway. Both of the main clinical trials, the phase 3 studies, were negative. They didn't show a benefit. However, when they went back and teased through the data, they said, well, it looked like this small group of people, when we look at them in particular, they actually received some benefit. And they started putting a magnifying glass and trying to understand who those people were. Clearly, it was the people who were earlier in their stage of disease. And there are a few other factors that they found that they said, hey, this stuff might really work. Because of that, it was taken to the accelerated approval pathway and approved on that pathway. There are real side effects. The side effects that were listed were brain swelling, brain edema, which is 35% of people who received it had that, and brain hemorrhaging or a little bit of blood was about 6%. Now, what needs to be remembered, though, is that these are really imaging related findings, and only about 10 to 20% of the people who had this side effect actually had a symptom related to it. But sometimes it can be quite serious. And that's what we're trying to uncover, is who is really at risk for having those side effects and when are they tolerable. It was restricted by the Center for Medicare and Medicaid Services on April 7th, where they said, all the drugs in this class, we're going to watch them, but we're not going to pay for them unless a person's in a clinical trial to prove its benefit. And a company came out and said eventually that it was going to cost about $28,000 a year for these monthly IV infusions. And they are currently in a phase 4 study that's being put together, and we have Indiana patients who are enrolling into that study as we speak to see if we can prove this drug's efficacy. Next slide. Then the real excitement began on January 6th with the drug called Leqembi. This was also approved on the accelerated pathway, and one phase 3 study met all endpoints. It was everything that they wanted to achieve. They achieved a 27% reduction in the rate of decline of the disease on a test called the CDR sum of boxes. And what this hopefully represents is that we're buying a lot of extra time, right? In a disease that might last 10 or 15 years, if we can slow it down 27%, we're buying people years of extra independence, which is exactly what we want and what we hope to achieve through delivering this drug to people. Unfortunately, they only have the one phase 3 study. They had a phase 2 study which showed that it was doing exactly what it was supposed to, but they didn't design the study to be able to show the cognitive benefit at that time. It seems to have lower side effects than the other drug. Again, we're still learning about that. The swelling risk is only about 12%, bleeding risk is 17%. So it's looking like it has a very favorable treatment profile. Again, a very small percentage of these folks actually have any symptoms related to those imaging findings of swelling and bleeding, just a little tiny bits of stuff we can see on an MRI scan. It's also restricted, and just yesterday, the Center for Medicare and Medicaid Services said that they are going to continue to restrict it, that they don't have enough data to be able to say that they're going to pay for it. And if you read their statement, they said, we sent a long letter to the Alzheimer's Association. So it's very clear that they know who to communicate with about this drug, and they know who is breathing down their neck to get it approved. So I think that was very, very clear from the statement that they made yesterday. This is about the same cost, $26,000 a year, every 2-week IV infusion. But this drug in particular is amenable to a shot. So this is public knowledge. This drug is being formulated into a weekly injection. And instead of having to go get an IV and be in an IV center and be, restrict your vacation, you can have these shots at home and give yourself a shot every week, and that will cover it. We've got Indiana people who are in a study right now, part of a clinical trial, they are the pilot folks who are injecting themselves with this drug as we speak. So we are hoping that this comes to fruition very quickly, because it should substantially lower the cost of being able to receive this medication. Next slide. So all these drugs, if we kind of take a step back and look at them, there are some differences. We really didn't think there were going to be big differences, but there does seem to be differences in side effects and efficacy. However, the main theme is that the earlier you treat somebody, the less side effects you're going to have, and the better the efficacy, so it seems. So this is really, really important. If you look at those clinical trials that showed the 27% slowdown, most of the people in that study that was positive did not have dementia. They are in an Alzheimer's disease pre-dementia state, right? We detected them early. We measured that they've got some memory problems, but they're still independent. They're still doing everything they want to do. And that's the key group of people that we have to find and we have to treat, because once we step into dementia land, then the drugs don't seem to work quite as well, and we might have more side effects. But at the earliest stages, it seems to work, and that's where we want to attack. Obviously, cost and accessibility are a huge consideration. And this is something you heard from Natalie about how we want to make sure that the people who are at highest risk and the communities at highest risk are able to get this medication and it's affordable. Really important. The other thing that's really important to note is that the cost goes far beyond what was quoted. That's just the cost of the drug. If you have to get an infusion, we've got infusion centers and IVs being placed and vital sign checks and nurses and pharmacists. And then we have a series of scans to look for those side effects. We gotta try to detect those and see if we need to do something about them or adjust the dose. So all of that costs extra money. And that's what we need Medicare to understand and to be able to pick up those costs. The other question that we have not answered yet is, when do you stop them? And that's a really important question that all of these drug companies are working very carefully on. How often can we spread out the doses? Can we figure out when it's appropriate to stop? And then will that help lower the cost and help with accessibility? So all of these are really important questions. At the bottom of the slide, I've shown just a few of the cases of the amyloid related imaging and the side effects from these drugs, swelling on the left and little tiny areas of bleeding smaller than the tip of a pencil that are shown on the right side. These are real side effects, but again, most people do not have symptoms and they resolve with treatment as you continue with treatment. Next slide. So the appropriate use guidelines are still being developed. This is a big question. Everybody asks, well, am I eligible to receive these drugs when Medicare pays for them? Or some people who have far more resources than I do ask, hey, can I just pay for this stuff and get it tomorrow? And the answer is no, not yet. The drug isn't quite available yet, but also we need to make sure that what we learned from the clinical trials translates into the guidance for people to be able to prescribe it. These guidelines are being created right now. The final version of these guidelines will probably be sent to journals in the next 1 to 2 weeks. And then we should have published guidelines on who should be receiving this drug probably in the next month or so. So this is a really rapidly evolving area, and I don't have all the answers to it yet because we need everybody's consensus on what to do. But again, we do know one of the most important things is that you have to be super early on. In the mild cognitive impairment range or the mild dementia range. We know you're going to have biomarker confirmation. That might be spinal fluid, it might be a PET scan, or it might be some blood tests, which we're hoping to roll those out as quickly as possible. But this is another cost barrier. Next slide. I just wanted to highlight, because of what Pete said earlier, this drug, Leqembi, is currently being used in a clinical trial for people who don't have any problems at all. It's called the AHEAD study, sponsored by the National Institute on Aging. It's for pre-symptomatic individuals age 55 and older who may have risk factors for Alzheimer's disease. They do a blood test, and if the blood test is what they expect, and then they will do a scan, and if they say, this person has a few plaques. They don't have any symptoms at all, but we can see a few plaques. Let's give them this drug and see if we can prevent them from ever getting dementia in the first place. So huge study, really important, pivotal study to understand, can we prevent disease? Can we go even a stage earlier? This is available. Indiana, of course, has access to this study like every other one out there, but a national study to look into prevention. Really, really cool. Next slide. And then it's not all about the plaques. So this is a big area of research. Everybody's always questioned, well, maybe it's not just about the plaques. Maybe we need to do something more. And it is controversial. Do we think that a drug like Leqembi is going to be the cure? It doesn't look that way, no. But is it potentially part of the cure? Yes, absolutely yes. And in the end, it might be like receiving chemotherapy for cancer. You get a cocktail of medicines. Maybe one attacks amyloid, one attacks tau, one attacks inflammation. One helps microglia do the right thing. It's probably going to be a combination of things depending on where we are and maybe what some of those biomarkers look like. So this is a really interesting evolving area. There's, again, drugs that are targeting the tangles that are inside the brain cells because these correlate well with symptoms. There are drugs that are helping with the inflammatory response in the brain that seems to just propagate and go on and on and on. And then we're also looking at drugs like those mRNA vaccines that people receive for the COVID-19. We're looking at that technology that could go and affect the way that cells produce proteins and produce things that cause Alzheimer's disease and put the brakes on those systems. And those are very exciting because it might be a single injection will last months to a year. And then maybe we only need to get an injection once every year or so. So those are really exciting RNA-based technologies that are currently being developed as well. Next slide. All right, and then there's a lot of research into what else can we, what's in our power from a lifestyle standpoint. Huge multi-center studies looking at how does exercise impact things? What about diet? What about where I live and the water I drink and all those environmental factors that are out there? And there we've got studies, the US Pointer study, all these Alzheimer's disease research centers, the Alzheimer's disease neuroimaging initiative. And I'm just going to highlight another program here that you might not have heard of called the Alzheimer's Gut Microbiome Project. And this is combining the work of all the diet studies that are out there and putting all these researchers together in one place, giving them the biggest data set you can possibly imagine to try to figure out how do the things that we eat, the places we live, the things that we're exposed to increase our risk of getting Alzheimer's, and how much of that can we address on a day-to-day basis with vitamins, supplements, changing the way we eat, changing some of the exposures that we have in our life. So these are really tangible things that we are working on every single day, and they're really great projects combining research from all over the world. Next slide. This is my last one, I promise. So just in summary, keys to success. So again, I think we really need community awareness and education. People need to know we can act as soon as there's a symptom and maybe even before. If you think there's a problem, find out about it. Talk to your doctor. Have them do a simple test on you. Maybe get a referral. This is really important. Early detection is key. Treatment, we need access. We need payment for drugs when they're appropriate. We need to have the right guidance. We need to prepare people, and we need to maintain independence as much as possible. And these drugs are super exciting. The last drug that was approved was over 20 years ago. And now we've got new medicines that we hope can really make a dent in this disease. But that's just the start still. It's just the start again. We need to think about these cocktails of different medicines attacking all the different parts of the disease so that we can really put the brakes on it. That's what I've got. Back to you, Jennifer and Natalie. I hope this was helpful.
Thank you so much, Dr. Brosh, for your time and for joining us this evening. I wish we had more time with you because this research information, it gives us hope. And I think about when I started this job 2.5 years ago, where we were talking about what could be in the pipeline. But my gosh, here we are with 2 new FDA approved treatments. So thank you so much for what you do in the research to help us end this disease and for being a part of this meeting with us tonight. So thank you. Also, I just want to say thank you, Pete, for telling your story and telling us your why. And I can't thank him enough for standing up and just being willing to be a part of the volunteer committee, to be the chair and to lead us in the Longest Day campaign. I tell you what, he has jumped in with 2 feet. He joined us on Advocacy Day. He was the first one in line to give me my folder. Let me go talk to representatives. So just thank him so much for everything that he does for the association and, for being with us tonight and leading this. I just realized my camera's not on. I apologize to everybody for all the technical difficulty. I don't think it's on. But again, thank you. And then I just always love to hear Natalie talk about our mission and to talk about what we're doing across the state of Indiana and all the great things. And I'm kind of like, oh, no wonder I'm tired. Look at everything we're doing across the state. But it's just really great. It brings a lot of hope, as I said, that we didn't have 2.5 years ago. And the way I look at it, our job is really just beginning. Because as you heard Dr. Brosh talk about, you heard Natalie say, our mission, our goal of being able to detect this disease early, we want that so that these treatments can be prescribed, because they don't work unless we prescribe them early. So I'm like, oh my gosh, we got to get that out there in community. We've got to tell people, advocate for yourself, advocate with your healthcare providers. I was out in community this morning at an Aging Gracefully symposium, and I literally had 3 people come up and they're like, I think I'm showing signs of dementia or Alzheimer's. What am I going to do? And I really, really encourage them. You need to advocate for yourself or advocate for your loved one. Talk to your healthcare provider because it's important. Again, early diagnosis is key. So all of us have sat through this presentation. You saw the prevalence and the growing prevalence of the disease. You saw how costly it is. We also saw that there's hope. And so you're kind of probably like, okay, now what do I do with this information? Well, this is kind of the part of the presentation, if you will, where we go for the ask. Like, we are asking you to join us in this fight to end Alzheimer's. And I know it sounds cliche, everybody's joining the fight, but I, as the Longest Day staff partner, like, this is a real passion for me because, again, my family has been impacted. For those of you that don't know me, I am Jennifer Lovell Budenbaum. Been with the association for 2.5 years. And I lost my aunt. It'll be 2 years in May. And we've had other family members impacted. And I feel like I just do this because I don't know what my cognitive future looks like. And if there's not, a cure in my lifetime, I hope there's one in maybe my children or my grandchildren's lifetime. So one of the ways that you can engage with the association is through the Longest Day campaign. Oh, we just went right back to Dr. Brush's. The Longest Day campaign, Natalie had talked about the Walk to End Alzheimer's. That's one of the signature campaigns. But the Longest Day is for those that maybe the walk isn't for them, or maybe they're in an area of the state where there's not a walk very close to them, or the timing of the year is not right for them. But this is another great way to engage. And so let me explain to you what the Longest Day is. So the Longest Day is inspired by the day with the most light, and that's the summer solstice. This year it happens to be June 21st, and individuals, organizations, and companies, they use this inspiration to outshine the darkness of Alzheimer's disease by participating in the campaign. So here's how you need to think about this campaign, because people get confused. They're like, oh, so where am I going, and what day am I going, and what am I doing on this day? No. It's a do-it-yourself fundraiser where you take the creativity and the passion of what you enjoy doing, and you turn it into a way to raise funds and awareness for the care, support, and advocacy and research efforts of the association. So again, it's how you want, where you want, when you want. So even though it's inspired by the Longest Day in June, if you're a skier, a snow skier, we don't have snow in June, knock on wood, but you could do your event in the middle of the winter, your activity. You do it whenever, wherever. Now, you might be one of those people who's like, well, I don't know that I personally want to spearhead something like this, but gosh, I can see my work doing it. Or maybe you're part of a Rotary, or a Bible study, or a book club, or just an organization, Kiwanis, whatever it might be. You guys can get involved as well. It doesn't have to be personal. You can take it to the workplace. And one of the reasons why you might want to do this, and we have a lot of senior communities, hospice, home health care, financial planners, they participate in the Longest Day because it positions their company as a philanthropic leader. It is showing them that you're a good community partner, that you understand that this is a public health issue, and you're doing something good in the community to support the association. And I love that it increases employee engagement. And this could be the best team building, bonding exercise. I'm working with a senior community right now, and they've got a group of employees together, and it is so fun to hear them just brainstorm, and you can see them bond and come together just over planning their activity. It increases visibility with consumers. So you'll post it on your social media. Here's what we're doing and why. We'll post it on our Facebook group. So you're getting additional exposure and visibility to your consumers. And then obviously you're going to amplify and impact and improve more lives. We were on what's called a town hall meeting today, and it's basically where all the chapters join in on a virtual call with the president of the company. And she was talking about, we've got to do more out in the community. This is the time for us to do it and get together and do it and make the impact. And now I'm just kind of feeling that it's not even pressure, it's like excitement, if you will, because we can definitely work together to improve the lives of many that are out there. So if you have any questions, I obviously will answer those on how we can work with you individually or with your organization or your company. Now, a lot of people are like, you cannot turn any activity into a fundraiser. And I was proving some people wrong this morning. They're like, yeah, I kind of like the idea, but I don't know what I would do. And just with a few questions, I'm like, what do you think about XYZ? And they're like, oh my gosh, yes, you can turn any activity into a fundraiser. So if you're not quite sure, you would love to get engaged, but don't know what to do, we are here to help you. But think about it. What do you enjoy hosting a backyard barbecue? Do you enjoy playing golf or tennis? I need to change that tennis to pickleball probably. Are you a runner? Something that has miles behind it. You could add more meaning to every mile. So if you go out for a jog every morning, you could turn that into a fundraiser. Here's some things we've done across the Indiana chapter, and this is not even a snapshot, to be honest with you. There are so many more activities, but we've got hiking, golf, crafts. You look down in the bottom corner, we've got a Peloton rider. And then over by the logo, this is one of my favorites. That's the IU volleyball team. And they came together this year and they painted the night purple. So they had a whole game that was dedicated to the Alzheimer's Association and raising funds. They've got purple bows on. It was so much fun. On the bottom, we have a pageant participant and she does Songs for a Smile. And she goes into senior communities as her fundraiser and she sings and brings smiles to their faces. And then there's Shola. Oh my gosh, she's a very creative artist and she paints pictures and people donate to her, not just because she's an awesome person. She had a direct connection to Alzheimer's and lost her mother to disease. So she uses her painting. Amy on there does a bourbon tasting. We had a fishing tournament. So as you can see, there's just so many opportunities to get involved in the Longest Day. Now, this is one of the things that we do not do. We don't have you register, pat you on the back and wish you luck. You're going to get support. You're going to get a committee coach. And let me tell you right now, if you're one of those people who loves to create events and you like to kind of see things to fruition or brainstorm with people, we can always use volunteers to kind of help us on the engagement committee, where you can coach people, talk to them about what they can do, how they can do it, turn it into a fundraiser, and how they can raise awareness as well. I'm your TLD staff partner, and I am always here to support you. And then the TLD kit, we'll deliver that straight to your house. And what's really, really fun this year is they've tailored the kits to what you register as your activity. Now, don't worry if you're like, I'm going to register, but I don't know what I'm going to do. You're going to get an awesome welcome kit as well. You're going to get a t-shirt. And I know somebody's on here from home office and I apologize, but I'm not a t-shirt person. But when I got this year's t-shirt, I was like, oh my gosh, finally an amazing t-shirt. I love the logo. I love the design. And what's awesome about it is when I wear my t-shirt, I get stopped when I'm in public at least one time, and people will make a comment like, oh, I'm a caregiver for my mother, or I lost my grandmother to Alzheimer's. So it's kind of that awareness piece, even though people are like, oh, another t-shirt. Trust me, wear the t-shirt and see what people say to you. You get the pennant banner, a participant guide, and then this is one of my new favorite tools. It's an awareness poster. It talks about some of the facts and figures that Natalie discussed in her presentation, and it just kind of substantiates, this is why we're doing what we're doing. So if I haven't inadvertently begged you to participate in the Longest Day, now I'm going to ask if you'll join us in participating in the Longest Day. Here's different ways that you can register. You can go directly online to alz.org/TLD. And that TLD stands for the Longest Day. You can even type that whole word out if you want, but we've given you the shortcut. You can text TLD to 51555. Or if you want to hop in the chat and just put register me, we'll definitely help you after this event and get you registered. So now here's the exciting part of the evening. I get to introduce Dr. David Mandelbaum. He is one of our Greater Indiana board members. And now to his long line of titles, he can add Longest Day participant. So I'm going to turn it over to Dr. Mandelbaum, and he's going to tell you why he chose to engage further with the association through the Longest Day campaign, as well as why he chose his activity that he did. So Dr. Mandelbaum?
All right, Jennifer, thank you very, very much. We've heard a lot of exciting information this evening. And as Jennifer said, I'm a practicing physician. I'm a board member of the Alzheimer's Association of Greater Indiana. And I practiced general surgery for 23 years before, just for a little background, before having a personal health issue that came up in 2009. And I had to actually give up my practice as a general surgeon because of that health issue. And it just happened to be at about that time that both of my parents, my father, who was a retired physician, a retired surgeon, professor of surgery himself, and my mom, who was the vibrant mother of 6 children, of which I'm the oldest, both developed dementia. And so I went from being a busy practicing general surgeon to doing administrative work in the hospital in which I had practiced for many years. But it also gave me the exposure and the experience of being a caregiver to not one, but both of my parents. And boy, did I learn a lot about dementia. I learned a lot about the stresses and what a huge burden it is to be a caregiver. And it was also during that time, so I not only learned about dementia, but through my exposure, learned about the Alzheimer's Association of Greater Indiana and wanted to get more involved. Also developed an interest in palliative medicine and hospice care. And so I transitioned after a couple of years of doing administrative duties in the hospital, transitioned to a new specialty after having given up surgery to palliative and hospice medicine. I've been practicing that ever since. Both of my parents passed away really from the ravages of dementia. My father, as a retired professor of surgery, he was certainly nothing like the brilliant man that he was that I grew up with. When he passed away in 2012, and my mom died in 2017. And it was soon thereafter that I actually attended the Chocolate Sunday Gala fundraiser that was mentioned earlier by Natalie. And that's when I got very involved very interested in getting involved with the Alzheimer's Association and ended up becoming a board member. So through that, and as a means of trying to honor and memorialize my parents, I wanted to get involved in fundraising. And, on a personal level, although we just heard about the research and the treatment and all the excitement surrounding all of that Dr. Brosh just mentioned and that Natalie had presented earlier, to me personally, I was drawn to fundraising for the education, the education of the community that we provide, and also to be able to provide the support to caregivers, because I had experienced it myself for a few years and thought, man, there's a real need out there. I know I was one of thousands throughout the state of Indiana who was providing that kind of care, and to be able to support caregivers just attracted me to the idea of doing some fundraising. Well, I looked into it a little bit as a board member and started hearing more about the project known as the Longest Day that Jennifer just described to us. And, the fundraisers that have been mentioned earlier, the Walk to End Alzheimer's is a walk, and it's a great walk, and it raises a lot of money. And as Natalie mentioned, the Indianapolis walk raised $1 million, more than $1 million this past year, which is fabulous. But a lot of organizations have fundraising walks. And then there's the gala, the Chocolate Sunday Gala. I would highly recommend it to anybody. I love it. I was there again this year. But again, it's a gala, and a lot of organizations have something somewhat similar. And so what attracted me to the Longest Day was, wow, as Jennifer said, come up with something that's fun, unique, something different that might not even normally be looked at as a fundraiser, and see if you can't use it to raise some funds for this great organization. And it was at about the time that I was thinking about these things that two things came together. First of all, I happened to be reading a book written by Dr. Sanjay Gupta who is a physician that you frequently see probably on television on CNN. He happens to be a neurosurgeon by training, and he wrote a book called Keep Sharp about brain health. And I would certainly recommend everybody who's joining us this evening to think about reading that book. It mentions some of the same things Dr. Brosh was just talking about: our environment, our diet, socializing, exercise, what kinds of things are out there that might be able to, if not prevent the development of dementia, at least delay the onset. So I'm reading that book, and it was exactly that time I realized that I had a problem under my own nose, and that was the addiction that my wife had developed for the game of pickleball. And she truly is, she's a retired nurse. She had gone to a high school class reunion and had met some old friends who realized or remembered that she had been quite an athlete herself when she was back in school. And they convinced her to take up pickleball. And by the time I started thinking about a longest day project, she had become literally addicted to it, where she plays anywhere between 3 and 5 times a week, just about every week. And so we decided to create a pickleball tournament as our fundraiser. And Pete, you're cordially invited this year to come to our second annual. But it was held last year in July in a park, Craig Park in Greenwood, Indiana, not far from where my wife and I live. And the only thing we knew is it was going to be fun. We had no preconceived notion about how many players we would have, how popular it would be, or even how much money we were going to raise. And we didn't care. We just knew that if we raised some money, it was going to make a difference and it was going to be highly appreciated. And that's all we're interested in. And also, most of all, just having fun with a summer event. So there are some pictures from our tournament. It turns out that it was played over a 3-day weekend, Friday, Saturday, Sunday, in late July. We had players register from the ages of 14 to 82, and the 82-year-old gentleman did win a silver medal as part of a men's doubles team in the tournament. The 3-day event attracted 231 registered players at 3 different levels, which made it the largest amateur pickleball tournament in central Indiana for the entire summer of 2022. And I say this proudly, and we raised almost $36,000 that then was obviously donated to the Alzheimer's Association. I say that because none of that was, as I said earlier, preconceived or predetermined. It was, we're going to have fun. And we know the one thing we know that's going to come of this is a really good time, a summer activity, outdoors, fresh air, exercise, socializing, all the things that I think are important to all of us as we age. And sure enough, it turned into a huge successful event. Anybody who is interested or has an interest in just having or has a fun pastime, a fun hobby, as Jennifer said, it can be easily turned into a fundraiser. And just doing something that you find fun and yet being able to raise funds for this great organization is just a wonderful all-around experience that we had last year. The picture right there in the middle is myself and my wife, the pickleball player, and our 2 grandkids who dressed for the occasion with their End Alzheimer's t-shirts. And it became a family event. I had help from multiple family members. Jennifer was incredibly supportive. And then the one last thing I want to mention, down there in the left lower picture, the gentleman in the white shirt is named Ron West. He is actually a nationally certified pickleball referee. He referees at national tournaments. During our tournament last summer, he turned 80 years old. He still plays pickleball himself and just volunteered his time. And whereas he referees major tournaments all over the country, he showed up for our tournament because he lives in Greenwood, not far from the park, and refereed some of the championship games, which just added a lot of excitement and interest to some of the amateur players that played in our tournament. So finally, I would just say again that This was fun. It was a blast. It never felt like work, even though we worked hard to make it happen. It just didn't feel that way. It just felt like doing something fun that was going to have this great benefit, not only to all of us and all the players, but to most of all to the Alzheimer's Association. And we're in the process of planning the second annual Making Memories Classic, we called it, that'll take place the last weekend of July again this coming summer. Thank you. Thank you for your time. I'm done. Jennifer, is there?
So Pete, are you still there?
Yes, I am.
There he is.
Sorry, Pete, I should have turned it over to you.
No, David, thank you. And it's very inspirational. I want to echo your sentiments, because I too, for the first time last year, created my own the Longest Day campaign. And it was just a baby step. But my guess is, if you're here and you're listening to our message right now, there's something about this and our mission that resonates with you, that hopefully can and should be a lifelong event, because the disease won't go away overnight. So even if it is, you're asking yourself, what can I do to get involved? Do what feels natural. Reach out for help. I would be ecstatic to be a part of helping some Longest Day campaigns get up and running. You have my commitment to help you and pull in resources as you can, but just know that whatever you do, it can and will make a difference. You can always go and grow from there, as David has just shared with you on the tremendous results he had from last, moving to the forward. So please register today. I just typed in my text on the phone and got immediately a registration link, because I too have to register my Longest Day event, which ironically will be pickleball at a local microbrewery nearby my home, in which people within my network are just looking for an excuse to get together, do something active, learn something new that they can relate to and benefit to a cause. So it probably is easier than we all think, but it does take some courage to get started. So any way we can help you in that, please let us know. We're here to support you.
So we thank you all for joining us this evening. And if you have any questions, all of you have my email address from me sending out the link. Don't hesitate to reach out. I am happy to connect you with any of the presenters this evening if you have any additional questions. So thank you and have a good evening. And we look forward to working with you in the Longest Day 2023 season. Have a good night, everybody.
Take care.